Hello, my name is Camila,
Hi, I'm Ashley.
I'm Stacy.
and this is our video project for our Putting It All Together case study for pediatrics. Ashley, do you want to start with maybe reading the case study?
Yeah. So some background of the case study. We are school nurses for a middle school student with ADHD, type 1 diabetes, and SDOH. So some social history. We're practicing in the school setting in a rural Title I community. It is the beginning of the school year, and one of our seventh grade students on our caseload is a 13-year-old named Aiden.
Mhm.
Aiden is an only child in a single parent household. Aiden's grandmother was living with Aiden and his mom until she passed away in July. Aiden's mom is a local retail grocery assistant manager and works evenings and weekends. Aiden receives free and reduced meals and eats both breakfast and lunch at school daily. His breakfast is at 7 a.m. and his lunch at noon. Aiden is an overall strong student and very social and has a specific learning disability called calculia. Medical history and current health status. Aiden is an otherwise healthy child who is fully vaccinated and diagnosed with both ADHD and type 1 diabetes in early elementary school. Aiden is able to provide a lot of self-care with his diabetes management, and you have delegated some of his daily care to an unlicensed assisted personnel. Aiden has an insulin pump and a continuous glucose monitor. His pump has a basal insulin level set at home, and he receives mealtime boluses at school. Aiden's mealtime insulin cover ratio is 1 unit per 12 grams of carbs. His blood sugar correction dose is zero point 0.5 units of insulin for every 50 mg over DL over 150 mg over DL. Aiden also takes his methylphenidate 30 milligrams by mouth at breakfast and 20 milligrams by mouth at lunch. History of the present situation. We've only worked with Aiden 1 year previously, and his glycemic control had been fairly stable. Last September, when we checked in with his mom with the start of the year care planning, his HbA1c was 7.0. And we recall that at the end of the school year, it was a little less stable when his grandmother was placed on hospice, and Aiden missed a lot of school and had to be reminded to report for medications before meals several times. We've noticed since school has started this year that his blood glucose has been elevated each morning despite having a continuous glucose monitor with alarms. It's Monday morning, and we receive a call from our delegated caregiver that was supervising Aiden's breakfast insulin bolus. And Aiden's CGM reading is over 400 with a trend of increasing. He denies abdominal pain or nausea. We advise that his bolus is administered as we are walking into the health room. We begin interacting with Aiden. We have him double his blood glucose with a finger stick. His reading is almost 500. We have him check his ketones as per school diabetic orders, which are trace, and he continues to deny any symptoms other than a slight headache. We double check Aiden's insulin pump, and his pump and tubing is intact and patent, and his basal insulin is running. Um, Upon further assessment, you find that Aiden has been estimating his carbohydrates for his dinner bolus every night based on about whatever my lunchtime carbs were, stating that he never really got the hang of counting carbs because his grandma always did it for him. They were always calculated at school. Aiden further states that his mom is working most evenings and sometimes he forgets about his dinner dose completely. He states he is unsure if he took any insulin last night. When we ask about his alarms on his CGM, he states that he silences them often because they are annoying. After speaking with Aiden for a bit, his blood glucose is trending downward. He is drinking clear liquids and continues to be asymptomatic. We tell him to go eat breakfast and tell him that we would like him to come back to the office after breakfast so we can talk further. He agrees. When we call his mom, she states that things have been very stressful since her mom passed away, and bereavement leave was only a few days, and states they do not have any additional family here. She also notes that Aiden and his grandma were really close, but he doesn't share his feelings. She states that Aiden is forgetful and that he doesn't like math, but should be able to calculate his own carbohydrates. She further said the doctor just talked to him about this. When you call his endocrinologist, she shares that Aiden's hemoglobin A1C was checked last month and was 12. She's concerned about the family and discusses further support. Okay, so moving on. The first question we have is what further assessment questions might we ask Aiden when he returns? We might ask Aiden the last time he changed the infusion set slash tubing, whether he's had recent pump malfunctions, details about his dinner routine and carb intake, so what he is typically eating for dinner, how often he checks his glucose outside of school, why he may not respond to CGM alarms, and why he finds them annoying, an emotional well-being slash support system since his grandmother's death.
Yeah, I really think really big on the emotional support because it sounds like that's what really like started this whole
Mhm.
trifecta. Like he went from a hemoglobin of A1C of 7 to 12. That's a really big difference. So he's just
Yeah.
not been managing it at all, it sounds like.
Yeah. Um, it sounds like also because his grandma played such a big role in calculating his carbohydrates for him that
Yeah.
kind of left him without that support, um, which is definitely important when assessing what other support system he has, considering his mom also is not around as much as she probably should be, considering his state. Um,
Yeah.
yeah,
Our
so
reference for that information is Wright, JB et al. 2017, and also the American Diabetes Association Professional Practice Committee 2024. Um, but yeah, so we could probably move on to the next question.
yeah, so based off of that, going into what patient problems are immediately identifiable in this situation, um, clearly lack of glycemic control, inconsistent insulin bolus at dinner, because he's silencing his alarms, inadequate carb counting ability, due to him just guessing based off of what he had for lunch. So there is no accurate count there. The act of Aiden silencing his CGM alarms, like I mentioned previously, and then additional psychosocial stress from recent loss of grandmother and slash bereavement. So yeah, so kind of like reiterating what we said. His mom not only is not there as much, but she also, I'm sure, is dealing with bereavement and grief from losing his grandma. Um, so I'm sure that plays a role in her ability to support him as well.
Yeah. What do you think, Stacy?
I agree. Um, I think that, um, like the next question, talking about prioritizing his problems, I think that definitely the first thing that we need to address is the hyperglycemia in order to prevent this progressing to diabetic ketoacidosis, and then reinforcing his insulin administration and carb count.
And briefly to mention citations for discussing our prioritization would be Lions et al. 2018, ISPAD 2022, and ADA 2024. Um, let's see.
And that was for question 3.
Yeah, and then
For question 2, did you mention citations for question 2, Bri?
oh, Smith A and Harris C 2018, and then ISPAD 2022 as well,
Okay.
which what was saying? Oh, the mention of acute hyperglycemia to prevent the progression to diabetic ketoacidosis is a big point, reinforcing insulin administration and accurate carb counting, especially when he's having unsupervised meals. So there's really no way to know like accurately what he's eating if he's eating on his own or if he's even eating what he says he's eating.
Right.
Um, Yeah, so moving on to, let's see, thinking long-term wise, how might these problems impact long-term health outcomes? Well, long-term health can be impacted. So if he's having persistent hyperglycemia due to uncontrolled insulin dosage, if he's is silencing his alarms and things like that, it can increase his risk for microvascular complications like neuropathy and nephropathy, which can lead to recurrent hospitalizations for diabetic ketoacidosis, like I mentioned above, in the previous question. And then let's see.
Yeah, if this continues, he's like at risk for more serious complications. I don't think like he doesn't really understand that. Like he could have vision loss or
Yeah.
damage.
And then especially with like his diagnosis of ADHD and impacting his school performance. So that's like another psychosocial aspect. If there's no management with his type 1 diabetes. Um,
Yeah.
Yeah, it also can have cognitive,
mhm.
um, it can lead to cognitive issues as well.
Mhm.
Yeah. Citations for these are Smith A and Harris C 2018, and then ADA 2024 again. Let's see. What other aspects? Oh, in relation to his ADHD, he's on methylphenidate, is mentioned, which I notice he's getting 30 milligrams in the morning and then 20 milligrams midday, which suggests that he has moderate to ADHD or to severe ADHD because he needs a sustained dose during the day at school.
You know
Um,
what I'm thinking, just from like his medication doses, just because the doctor split it throughout the day, his ADHD symptoms probably affect him throughout most of the day. And
mm.
that could explain why he's so forgetful by the time it's time for his care, you know?
Or at dinner time when the last time he took his medication was midday.
Yeah. So maybe he needs to be reevaluated.
You
Yeah,
know, another thing I also worry about with methylphenidate is appetite suppression, and
I
I
was just
wonder how
gonna say
that
that.
affects
That's a
him
good
eating
point.
and getting calories and how that affects his
Hmm.
getting carbs and
Yeah,
eating carbs. And
I was gonna say that too. I know that's a big side effect. Um, yeah, I'd be curious to know what his like trend has been weight wise and just nutrition wise over the last since he's had his last oh my gosh, what is it? HbA1c.
Hmm. Yeah.
Um,
Our citations for that question are Charak G. Carneal E. et al. 2020. Also the National Institute for Health and Care Excellence 2018. And moving on to the next question, what potential social determinants of health or environmental factors are identified in this case study? Um, So, some potential social determinants of health or environmental factors include Aiden's enrollment at a rural Title I school, a single parent household, the presence of financial limitations, such as free/reduced meals, Aiden's mom working evenings and weekends, and limited support network after the grandmother's death. I mean, she only had what, a few days for bereavement?
Yeah.
Yeah, I'm
Yeah. What was it actually?
pretty sure she said like a few.
Yeah, I just said a few days.
Yeah. So pretty much nothing.
Yeah. It's like he doesn't have much supervision
Hmm.
over him, and also you're limiting the resources he has access to. If they don't have a steady income coming in, then how are they supposed to afford like, fresh fruits and vegetables?
Hmm.
It's cheaper to just get the fast, quick stuff, what mom's not around to cook for you, something cheap. Um,
Cheap. Yeah.
so that's probably why it's making self-management harder for him. I mean, after all, he is a child.
Also, I would think the risk of losing the ability to obtain his insulin and his insulin pump supplies, because that is
Mhm.
so expensive. And I don't know. Um,
Does he have insurance? Does it
I was
say?
gonna say I don't know what their current.
Yeah, I don't think it mentioned what their situation is as far as medical supplies is.
I don't think so either. I didn't see anything, but I would be curious to know.
Yeah, I agree with you there.
Financially, because he's on free and reduced
Mhm.
meals. I don't know what the quality of the food is like at school.
Right. Hmm.
Um, I would assume he would be on you would think he would be on a different diet than like a general diet.
Hmm.
Um, what else? Oh yeah, lack of supervision. She's working evenings and weekends. Um, which is like, how do you provide that support during the time, like the hours of the day where you're not in school, your mom's working, so you have to hire somebody, but who's paying that person?
Mhm. 7 is given Aiden's environment, diagnoses, and biological age, what are some possible contributors to his deviation from his care? Some possible obstacles that Aiden may be facing are include affecting or that are affecting his ability to properly care for himself, include grieving the loss of his grandmother, reduced supervision due to his mom working evenings and weekends, ADHD related forgetfulness, his dislike for math, which is influencing his ability to count carbs, and limited confidence in independent diabetes management. Um,
Yeah. So I was also I feel like I um also noticed that his mom said he doesn't like math but should be able to calculate his own carbohydrates. The doctor just talked to him about this. So it almost seems as if she's kind of like irritated about it.
mhm,
Um, which I feel like she probably, from what it seems, wants him to be more independent and be able to do it on his own. But at the same time, like he's 13, but I feel like that's still like thinking about being 13, I can't imagine like having to control all of these things at once for myself with while grieving, while feeling like you have a single parent household and your mom's not there because she's working. But as a 13-year-old, you don't really understand that. Like I feel like you're very much in like it's a hard age.
Yeah, I was thinking about him being that age, and he's got this growing desire for independence, but he also doesn't have the executive functioning skills yet to really put it all together and
Mhm.
manage this complex condition that he has. And also he's probably got peers and a social life that takes priority over this, thing that probably weighs pretty heavy on him. And
Yeah.
also there's like risk taking and pushing boundaries and stuff that are common at that age. And, I can see why he probably ignores alarms and skips taking care of himself. And it's all part of that age.
Yeah, definitely.
yeah, really good points, Stacy.
Hmm.
So social. Our sources for number 7 include Josel L. and Weiner S. 2019. Also Hook G. et al. 2011. And Now moving on to question 8. What are some evidence-based tools that can be used to support Aiden in improving self-efficacy? Some tools that can be used to help him include digital health apps, to help counting his carbs. I'm sure his cell phone is like his world right now, especially in this day and age. Integrating his CGM alerts due to with a caregiver due to Aiden silencing them. Um, Integrating. I think that kind of means like having a caregiver watch over.
Mm-hmm.
Yeah,
Yeah.
yeah. Um, Also collaboration with school-based diabetes education programs and ADHD friendly checklists to help Aiden stay on track. Um, yeah.
So yeah, I know a forgetfulness, at least from what I know, with ADHD is a big symptom. So keeping something maybe that just like reminds him like that he can just look at in the evening, or like logging his food. It's hard because I don't know how realistic that is with that age. But I guess like during school, maybe having something that he can log with a school nurse or another caregiver while at school that kind of teaches him. And then that way they can watch him do it and then go home and apply the same practice, hopefully. And then maybe like have his mom when she can check in on that process
Hmm.
and see how that's going.
Yeah.
Yeah. I also think every once in a while having like short structured conversations with the school nurse or with a diabetes educator, which I know is really hard in like a school that's limited with resources, but um, with a diabetes educator where they focus on like identifying his goals and maybe barriers and internal motivations and stuff,
Mhm.
and maybe get an idea of what's getting in the way of him doing what he needs to do in order to stay on top of these things. Just every once in a while, having conversations about those things. But
Yeah,
Yeah.
sure. Good point.
yeah, definitely things like having checklists. I know those are really helpful with kids with ADHD.
Hmm.
Yeah. Um,
Source.
Also, peer groups are also
Oh
really
yeah.
good. But
yeah.
again, going back to schools that don't have a lot of resources, you don't usually find those things. But peer groups for adolescents with type 1 diabetes are also really helpful.
Yeah.
Even if it's a virtual group.
Yeah.
Hmm. Yeah.
Our references for that question include Seeskin E et al. 2018 and Lyon C et al. 2018. So question 9, what are some family-centered interventions that can be employed? Um, well, first, starting with mom, we want to train mom in simplified carb counting strategies. Um, she may be frustrated with him not knowing it, but do we know if mom knows how to do it? And
Mm.
because if she knows how to do it, she knows how to explain it to him and teach him. So I think starting with mom would be a um, great idea. Also, setting phone reminders for dinner insulin administration, referrals for Aiden and his mom to attend grief counseling, um, to start with where they're at psychosocially. If they're going through a really hard time, I'm pretty sure insulin administration and carb counting is such a nuisance. Like, it's like a chore, most likely, right now, especially. Um, and involving family and pump alarm response plans to improve care adherence. Um,
Yeah.
yeah.
Good.
The references for that are Wright, JB et al. 2017 and ADA 2024. Um, so what are some potential patient-centered education topics to address with Aiden? Um, Skills regarding counting carbs. We've mentioned that, explaining the importance of basal and bolus insulin. um, the importance of not silencing CGM alarms, ketone testing, and recognizing the early signs and symptoms of hyperglycemia. Mm, I feel like also not only early signs, but also what are the consequences?
Education for sure. Yeah.
What are the consequences of this long term? Like, what is it gonna look like to
Well,
Aiden?
and like exactly what you're saying, perfect for his scenario because he was what in the 400s and he said he was asymptomatic. So it's like if
Yeah.
he doesn't think anything's going on, but he's in the 400s or 500s even, then it's like, how are we supposed to educate him recognizing
Yeah.
those crucial signs when he thinks he's not having any besides he said a slight headache, I think, when he was close to 500.
Yeah.
Yeah.
Also, um, I think educating him on how grief and stress
Mm,
can raise his blood sugar, how it can affect his blood sugar would be
mm,
good education, and also some healthy coping strategies.
mm.
Talking to trusted adults and physical activity, journaling, that kind of stuff. How healthy coping strategies can help.
For
Wow.
sure.
Wait. Yeah.
Also, how to ask for help from school staff and his mom when if he needs help,
Mm,
with self-advocating.
yeah. That's huge for his age, for sure.
Yeah.
Yeah. So our references for that are Wright JB et al. 2017, um, Lyon C et al. 2018, and ISPAD 2022. Um, Stacy, do you want to take over the last four?
Um, Question 11, who are important individuals to coordinate with on care planning for Aiden? Care planning team members could include an endocrinologist, a school nurse, teachers, a counselor, a dietitian, and also Aiden's mom. Sorry, my dog is coughing right now.
That's okay.
An endocrinologist who could oversee his insulin regimen, um,
Hmm.
Mhm.
his
Yeah.
PCP.
Yeah. Collaborative care there, I'm sure.
Yeah.
Um, I don't
I'm
know.
so sorry. My dog is having a coughing fit right now.
That's okay. I know you said we said counselor, because there's a school counselor, but also like a therapist possibly
Hmm
to help
Yeah,
with some.
someone for like grief support
Yeah,
and someone to address like emotional and behavioral barriers to
Yeah.
self-care.
because not only is it stressful to go through a family death, it's also stressful to have a chronic condition in itself.
Yes,
Yeah.
for
And
sure.
I feel like the separation of a therapist outside of his school environment where his peers are at and that whole dynamic maybe would provide a better outcome, more likely that he would continue on, I think, maybe.
Yeah, I agree. Our references for that is includes Wright, JB et al. 2017 and ADA 2024.
Okay, question 12. What immediate interventions can you implement to assist Aiden with glycemic control? Immediate interventions to assist Aiden could include supervising breakfast bolus to ensure correct insulin dose, checking his ketones, encouraging intake of fluids, and rechecking his glucose mid-morning to ensure his safety.
Yeah.
Um,
Also, I know I said supervising breakfast bolus, checking ketones, rechecking. I feel like that kind of hits all of them, actually.
Yeah.
I'm trying to think.
I feel
Yeah.
like immediate wise, that's probably like
Yeah.
pretty, yeah.
Yeah. Our references are Smith A and Harris C 2018, ADA 2024, ISPAD 2022.
What is at least one other intervention you can provide to Aiden for health promotion and maintenance? An intervention that can be provided to Aiden regarding health promotion and maintenance for diabetes self-management is education focusing on carb counting and digital tools to assist Aiden with tracking.
And then also kind of like what we've all mentioned, I think the additional things like education regarding like what to watch out for risks of hyperglycemia. And then education with his mom as well, because I think that will help with health promotion, hopefully from his mom to him, if she has proper education. And then I can't remember what else you said, Camila. I can't remember. You said something about what did you say? Oh, no, we were talking about checklists for
Yeah.
maintenance. I feel like that would be a good.
Yeah. Yeah. Mhm.
References for that are Lyons C et al. 2018 and Sesgen E et al. 2018.
Question 14. What are two ways you can measure outcomes for Aiden? Two ways to measure outcomes would be by A1C reduction in 3 to 6 months and also improved CGM alarm response rates. Those are pretty self-explanatory.
Yeah.
Yeah.
References for that are Smith A and Harris C 2018, ADA 2024, Sesgen E et al. 2018.
Perfect.
All right, well, that was our putting it all together case study, Peds. I hope you enjoyed watching this, and yeah.
Bye.
Bye.